Hello. Once again, I'd like to update you on the current state of dentistry and how it impacts on our patients at the Mayhill. As you know, dentistry has pretty much been at standstill now for over 2 months. On Friday, we were hoping for some good news, some news that might break this impasse from the Chief Dental Officer of Wales, a lady called Colette Bridgman. She certainly has a very difficult job, and I have respect for her in many regards, but I feel that she hasn't taken a decision that's in the best interests of my patients. So I am quite upset about it. We have calmed down a little bit now. She's chosen to offer further restrictions in response to Covid-19, but she's embedded them within a much wider document that deals with healthcare issues in Wales. And undoubtedly these are important things. But for me, the only thing that should be on her desk at the moment is the dental response to Covid-19. I'm sure you all feel the same way. This is the most important thing that faces us at the moment. Every single dentist I know has looked at the science, looked at the best evidence, looked to our dental partners within Europe and within the Western world, who have pretty much all resumed practice now. We've looked at them, we've put risk assessments in place to protect ourselves, our staff, patients, and of course the wider community. Standard operating procedures are in place, and we have the PPE. We all understand that dentistry cannot resume in the way that it was pre-COVID, but we want to get to our patients who need urgent care, who are in various states of distress with their teeth and other issues, which are of course all getting worse. I personally, although I sort of respect what work is being done in the urgent dental care centres, I don't want to send my patients there. I want to do everything that I can in my practice to limit their exposure to this emergency service. We're struggling, and it's ironic, I think, that our medical colleagues in the early part of this pandemic were screaming, we haven't got the equipment, we haven't got the PPE, we can't do our jobs. Dentistry is now screaming, we have got the PPE, we feel confident that we can deliver treatment to our patients, we have got the equipment, and we've got the know-how. As I've said many times, dental practices have had cross-infection control at their core for decades. And I think essentially what the Chief Dental Officer is saying to me and saying to my colleagues, no, you don't have the knowledge, you don't have the equipment, and I don't trust you to get back to some semblance of normality. And I think, I'm not being unkind to her, but I think she will live to regret that stance that she's taken. So what are we going to do? Well, we've pretty much got to carry on as we have done. And I once again, I would encourage you to contact us if you're having difficulties or trouble. We will do our best to help you. It's not simply about advice, analgesia, and antibiotics. Those things may be helpful in holding back infection and pain, but they're absolutely no solution. And they should not be part of a modern healthcare system, albeit one that's under strain because of Covid-19. So I think what we're going to try and do is start to reawaken the practice in the early part of June. We know we've got a list of patients who are having difficulties, and we are going to slowly start to contact you. I would ask you not to contact us unless you are in dire straits. We're going to try and get these issues dealt with in the most appropriate way. We don't want to break any rules, but there comes a point where we have to put the interests of our patients first, and that's exactly what we intend to do. So once again, I'm going to say what I always say, which is stay safe, look after your families, and be assured that we are really trying our very best under extremely difficult circumstances to help you.